the future will not wait. So let this forum be remembered not for its speeches, but for its outcomes, not for its declarations, but for its delivery.
We do not need to reinvent the wheel. Rather, we must learn how to adapt these solutions effectively in our own context.
Ensemble, construisons l'Afrique de la santé équitable, résiliente et durable.
This isn't just another project. It's a dynamic, multi-phase effort designed to inform health preparedness across Eastern and Southern Africa.
This year's theme, Enhancing Health Systems for Equity, Resilience and Sustainability, is both timely and relevant.
We celebrated our Golden Jubilee last year, and we are moving on the journey to continue making huge impacts in the region. The ECSA Best Practices Forum was introduced as a flagship platform for the organization.
It is time for us as Africans to think. When we talked about the Bamako Initiative, intersectoral collaboration, primary health care, we need to rethink and reboot and move.
Equity is not just words, it's a social, political drive. We still held firm. The pandemic attack by COVID pandemic. We are now facing the cholera pandemic, and we are also now facing the mpox pandemic. So we are very strong epidemic preparedness and response system, holding firm on our borders, but also helping across the borders with our colleagues and friends in Mozambique, Malawi, Zambia, and across. We have a public health focus, which has done very well to put promotion and prevention, but not enough on health protection and legislation. And we are able to share and take this model forward, but also learn. And we have been also working with the Africa CDC big push. This is making a fundamental change.
We wanted to assess the current financing landscape, quantify the extent of the USAID's funding reduction, and explore some of the implications for health systems and potential pathways to strengthen financial sustainability. With this continued downward trend in the USAID across the ECSA-HC member states over the past 3 years, we're experiencing over 30% in critical vertical program support. The shortfall has led to widening fiscal gaps, particularly in HIV and AIDS and reproductive health programs. And while some countries have increased domestic allocations to health, most have not met the required threshold of the Abuja Declaration to compensate for the funding decline. Some of the actions we're asking today will be that how do we now, as member states, come up with different methods of diversifying financing sources? How do we, as member states, enhance efficiency and reduce losses due to imprudent spending?
So the rationale or justification is self-evident. The reference to COVID and the need for procurement and logistics to get medical supplies, vaccines, PPEs, and many other supplies cannot be overemphasized. So at the end of the session, we would want to get a common understanding of the priority actions, and we underline actions to scale up local manufacturing for health security in the region.
We also appreciate that the COVID-19 pandemic catalyzed the emergence of health commodities nationalism. Beyond what it is that we know in the way of vaccines, there was also the breakage in the supply chain systems that led to us not being able to get even the APIs that are used to manufacture basic commodities, and the economic impact has been felt years later. The Africa CDC has set forth a rather ambitious target, and they are looking to see how we can be able to make sure that 60% of the vaccine requirements are taken care of by local manufacturers by the year 2040.
That is very much our approach, and we're delighted to work in a number of countries from ECSA, most countries. But there are rate-limiting factors. Money, people, power, oxygen, and space.
People said Malawi can't, shouldn't, will not have a medical school. But even within our space, if you want to have something done, you can do it.